You wake up already tired, as if someone borrowed your energy overnight and forgot to return it. The room feels colder than it should. Coffee helps you function, but it doesn't quite bring the lights all the way back on. By mid-afternoon, your brain hits molasses. Simple tasks take 3 attempts, names slip through your fingers, and your motivation fades just when you finally have time for yourself. If this sounds familiar, your thyroid might be part of the story. Today, we're looking at 3 science-backed vitamins that may support healthy thyroid function. No miracle claims, just what measured, cautious research suggests and how to use it in real life. Here, everything is explained in plain language and grounded in reputable medical sources. This is educational, not medical care, and it's designed to help you have a smarter, calmer conversation with your clinician, one where you bring observations, questions, and a simple plan rather than a shopping bag of random supplements. Let's make this easy to follow. You'll hear what each vitamin does, why it may matter for hypothyroid symptoms, common signs you can track at home, and safer ways to act. We'll end with a short action plan you can start today, something you can do even if your schedule is already full. First, vitamin D. Think of vitamin D as an immune system coach that encourages tolerance, helping the body distinguish friend from foe. That's relevant because the most common cause of an underactive thyroid in iodine-sufficient countries is autoimmune, often called Hashimoto's thyroiditis. According to summaries from endocrine and thyroid associations, people with autoimmune thyroid disease frequently have lower blood levels of vitamin D, and small clinical trials suggest that correcting a true deficiency may modestly influence immune activity over time. Vitamin D also supports bone and muscle function, which matters if fatigue and achiness are part of your daily life. Now, none of this means that vitamin D treats thyroid disease directly. It means that if your lab work shows a deficiency, bringing levels into a healthy range under professional guidance may support systems that influence how you feel. What are the real-world clues? You rarely see the sun during the middle of the day. You live far from the equator. You have darker skin and spend most of your time indoors. Winters seem to press you down. Some people notice frequent infections, low mood during darker months, muscle weakness climbing stairs, or bone tenderness after minor bumps. None of these prove deficiency, but together they form a pattern worth testing. Ask about the 25-hydroxyvitamin D blood test, 25-OHD for short. Labs reported in nanograms per milliliter or nanomoles per liter. Clinicians vary in target ranges, and the right approach is to correct a deficiency safely rather than chase an extreme number because you saw it in a forum. What can you do without turning your life upside down? Food first and sunlight smart. 2 servings of fatty fish this week, salmon, sardines, trout, plus eggs and fortified dairy or plant milks if they fit your diet. Short, regular exposures to midday sun on bare skin, balanced with skin cancer prevention, can help many people inch upward. If your blood work confirms deficiency, your clinician may recommend a supplement and recheck. Common mistakes include megadosing for months without labs, ignoring calcium and kidney health, or assuming that vitamin D alone explains every symptom from mood to sleep. Use it as one tool inside a broader plan that includes thyroid labs, sleep, protein, movement, and gentle stress hygiene. Speaking of instruction manuals, let's pivot to vitamin A, the quiet editor that helps your cells read thyroid hormone messages clearly. Vitamin A exists as retinol from animal foods and some supplements, and as carotenoids from colorful plants that your body converts to retinol. Why does this matter? Thyroid regulation starts in the brain, where TSH signals the thyroid gland. According to clinical nutrition reviews and endocrine texts, adequate vitamin A status appears to support normal TSH signaling and the way tissues respond to thyroid hormones. Human data suggest associations between low vitamin A intake and altered thyroid function in certain settings, while excess preformed vitamin A can create its own problems, including effects on bone and liver. The theme, repeated by medical references, is balance, neither too little nor too much. How do you spot a potential gap? Diet patterns are the first clue. Very low intake of animal products, little to no fortified dairy alternatives, and minimal fat can lower retinol intake and impair carotenoid absorption. You might notice very dry skin, frequent respiratory infections, or night vision challenges. None of these diagnose a deficiency, but they're gentle prompts to pause and ask. If you have fat malabsorption issues, inflammatory bowel disease, a history of restrictive dieting, or weight loss surgeries, you'll want individualized guidance. There's also a fascinating nuance many clinicians mention. Hypothyroidism may reduce conversion of carotenoids to retinol in some people, which means relying solely on beta-carotene supplements may not fully address needs. That's one reason food variety matters so much here. So, what's workable in a normal week? Aim for color and moderation. Add a couple of eggs, a cup of mixed greens, and a bright orange vegetable, carrots, pumpkin, or sweet potato, to your day. If you enjoy dairy, choose options that naturally contain retinol. If you don't, consider fortified plant milks and yogurts. Liver is a concentrated source of retinol, but it's potent. Think occasional, not routine. Pair colorful vegetables with a little fat, olive oil, avocado, nuts, so you actually absorb the carotenoids. Be cautious with supplements. Pre-formed retinol adds up quickly if you're also eating fortified foods, and pregnancy changes everything. This is where direct medical advice is essential. Another common misconception is treating beta-carotene as a one-to-one substitute for retinol. Conversion depends on genes, gut health, and your overall diet. Next, vitamin B12, the nerve and energy co-pilot. Why include B12 in a thyroid video? Because hypothyroidism, especially when autoimmune, travels in the same circles as conditions that reduce B12 absorption. According to large hospital systems and the NIH, B12 deficiency is more common in people with autoimmune disorders, in long-term users of metformin or acid-reducing medications, and in those avoiding animal foods without reliable fortified alternatives. The symptom overlap can be confusing. Fatigue, weakness, numbness or tingling in hands and feet, balance problems, memory fog, and a sore, smooth tongue. Without testing, it's easy to mistake B12 deficiency for just thyroid. So what's the smart path? Ask about a serum B12 test, and when the result is borderline, a methylmalonic acid MMA or homocysteine level to clarify functional status. If deficiency is confirmed, clinicians tailor treatment, oral or injectable B12, based on the cause, whether it's low intake, malabsorption, or autoimmune gastritis. Food first still matters. Eggs, dairy, fish, and lean meats are reliable sources. If you're vegan or mostly plant-based, use fortified foods consistently and check labels. A frequent mistake is taking high-dose B12 for energy without testing, meanwhile missing other causes of fatigue like iron or folate deficiency, low protein, sleep debt, or undertreated thyroid disease. Another is stopping supplementation as soon as you feel better, without rechecking levels or addressing the root cause, which sets you up for a silent relapse months later. Let's connect the dots so this doesn't sound like 3 random tips. Vitamin D supports immune balance and musculoskeletal function. Important if your thyroid issue has an autoimmune component and you're dealing with aches and weakness. Vitamin A helps the brain-to-thyroid conversation and the cell-level reading of hormone instructions, which may matter when you feel hypothyroid despite numbers that look okay. Vitamin B12 keeps your mitochondria and nerves humming so that when thyroid hormones arrive, your cells can actually perform. None of these replace medication when it's indicated. They round out the system that helps medication work as intended and helps you feel human again. What about safety and timing? If you take levothyroxine or a combination therapy, keep it on an empty stomach the same way every day. Consistency helps your labs mean something. Separate thyroid medication from minerals like calcium and iron by several hours to avoid absorption issues. Vitamin D, A, and B12 aren't usually the absorption culprits, but the big idea is to avoid stacking everything together at the same moment, then wondering why your thyroid pill stopped working. If you're adding a supplement, add one change at a time, keep the dose modest unless your clinician prescribes otherwise, and give it a few weeks before you judge the effect. Track, test, adjust. That order protects you from guessing. Now, some myths to clear the fog. Myth 1. If I take vitamin D, I won't need thyroid medication. Real-world evidence doesn't support that. If your thyroid can't make enough hormone, you need the hormone. Vitamin D may support the immune context, but doesn't replace what the gland can't produce. Myth 2. Beta-carotene supplements are the same as vitamin A. Not exactly. Conversion varies, and in some people it's inefficient. Food variety matters, and medical guidance matters even more. Myth 3. B12 shots give energy to everyone. If you're not deficient, the effect is usually minimal. The people who feel dramatically better are often correcting a real deficiency. Myth 4. More is better. With fat-soluble vitamins like A and D, that can be risky. With B12, while toxicity is rare, megadoses can mask other issues or distract you from the real cause of symptoms. Precision beats excess. If you like a clear plan, here's a simple 7-day diary that transforms your next appointment. Each day, jot down: wake up energy from 0 to 10, mid-afternoon crash, yes, no, sensitivity to cold from 0 to 10, resting heart rate, bowel pattern, any numbness or tingling episodes, and your main protein sources. Note sunlight minutes between 10 a.m. and 2 p.m. and include whether you ate fatty fish, eggs, dairy, or fortified alternatives, leafy greens, and an orange or dark green vegetable. Write down any new supplements with dose and time. This turns a vague, "I feel off," into usable data. When you go in for labs, ask about TSH, free T4, and, if clinically appropriate, free T3. Ask about thyroid peroxidase antibodies if autoimmune disease is on the table. Add 25 OHD for vitamin D, B12 with MMA if borderline, ferritin for iron status, and consider retinol or related markers only if your clinician sees reason. You're not requesting endless tests. You're matching tests to your story. How do you start gently today? Pick one food upgrade based on your likely gap. If vitamin D is your weak link, schedule 2 fish dinners this week and plan a couple of short midday walks with skin protection appropriate for you. If vitamin A intake is skimpy, add eggs at breakfast and a bright vegetable at lunch with a drizzle of olive oil. If B12 is the concern, choose a fortified plant milk for breakfast or add an egg and greens wrap to lunch. Keep it simple. One change you can repeat beats 5 you abandon by Thursday. If your symptoms are severe, or you're pregnant or planning to be, or you have other medical conditions, please go straight to personalized care before tinkering. Thyroid health intersects with so many systems: iron metabolism, gut health, stress hormones, sleep, that the most compassionate thing you can do for yourself is get a tailored plan rather than crowdsourced fixes. Let's ground this in the kind of evidence you can trust. According to the NIH Office of Dietary Supplements, low 25 OHD levels are common. Testing guides the need for supplementation, and excessive dosing can cause harm. So lab-guided correction is the standard. The American Thyroid Association explains that autoimmune thyroiditis is a leading cause of hypothyroidism and emphasizes appropriate testing and consistent medication timing. Clinical overviews from major hospitals describe how B12 deficiency presents, who is at higher risk, and how to confirm it with MMA when levels are borderline. Nutrition and endocrine reviews discuss vitamin A's role in thyroid signaling and why both deficiency and excess matter. And several peer-reviewed studies explore associations between vitamin D status and autoimmune thyroid disease, with cautious suggestions that correcting a true deficiency may influence antibody levels over time. The pattern is consistent. Use reliable tests, correct real deficiencies, prefer food first where possible, supplement thoughtfully, and keep your thyroid treatment steady. Now, let's recap so the main ideas stick. If you're cold, tired, foggy, and frustrated, 3 vitamins deserve attention, with testing, not guesswork. Vitamin D may help the immune environment and support bones and muscles. Vitamin A helps your cells understand and act on thyroid instructions. And vitamin B12 keeps nerves and energy metabolism ready to respond. None of them replaces thyroid medication when it's indicated, and none of them explains every symptom. But together, inside a plan that includes consistent medication timing, protein-rich meals, regular movement, and better sleep, they can make the difference between barely getting through and starting to feel like me again. If this helped, drop a comment with your biggest thyroid supplement question. What confuses you? What changed when you tried something? And what your clinician recommended? Share this with a friend who's been dragging for months and blaming getting older. Subscribe if you want more science-backed, practical videos that meet you where you are. Next time, we'll talk about selenium and iodine, how to find the sweet spot, who should be extra cautious, and why more can sometimes nudge you the wrong way. And before we close, a final word that matters. This is educational content. It's here to help you ask better questions and make safer choices. Don't stop, start, or change any prescription or supplement without guidance from your healthcare professional, especially if you're pregnant, planning to be, or managing other conditions. Your health deserves precision, not guesses.